The press conference chaired by Dr. David Kupfer.
Finally, after years of clinical research and experience with ADHD, our knowledge about the cause or causes of ADHD remains speculative. And indeed, we do not have any strategies with respect to the prevention of ADHD at this time.
Stressing the speculative nature of its cause or causes, Kupfer avoids the fact that ADHD doesn't exist, that the children are normal, and that all that has to be done to prevent ADHD is to confess that fact openly and publicly.
Jeff Levine with Medcast. Many say that psychostimulants like Ritalin are overprescribed. Some doctors say that these medications are underprescribed. Did you come to any sort of consensus or agreement as to whether or not, generally speaking, there's too much prescribing out there, or maybe the disease is generally undertreated?
I think the difficulty in answering the question is something that was already brought out, which is that there's no gold standard for the diagnosis, so that it's very difficult to look at a prescribing practice and say that this is appropriate or inappropriate unless you have a standard by which to judge the diagnosis of the disease. And that's why it's very difficult to answer the question head on.
Unless one knows who has it and who doesn't have it, one cannot possibly know if there is overtreatment or undertreatment.
John Roberts with the CBS Evening News. Did the panel take a look at the dramatic increase in the number, a quick label for other childhood problems that may require a more aggressive intervention than just a pharmacological one?
Donna Ferrero, I think, as we stated in the statement, that which results in sometimes overdiagnosis and sometimes underdiagnosis.
Yes.
Joe Palca with National Public Radio. Could you explain a little bit more about how you can say, or how you do say, that the diagnosis is reliable, or it's a reliably diagnosable disease without any agreed upon tool or test or instrument for reaching that diagnosis? And second of all, just to go back a step, there's very little talk about what someone with this disorder appears like. I mean, could someone on the panel just say, this is what a child with this disorder behaves like, so that you would know when you think it might be an issue if it was in someone like that in your family or in your neighborhood or in your school or whatever?
Bob? I'm going to answer half. I think we're using reliability in a very specific way here. And in reliability, it basically means that if a number of different experienced physicians using the same set of monitoring standards examine the same child, they'll agree in a large proportion of the cases. That's what we mean by reliability. And I think that one of the things that the panel has been discussing among ourselves is that that is different from the term validity, which I think is what you're talking about, and is quite different outcome measure.
I think just to amplify on that part of the thing, we did hear, and the panel evaluated the number of diagnostic interview methods that are available, and those methods do appear to be reliable. However, what we're also concluding is at this point we do not have an independent diagnostic and valid test, such as a biological test or such as a blood test.
I still want to get to the other part of the question, which is just a description of what you might be looking for.
Okay.
But before you go on to that, it sounds a little bit like you're saying that the definition is a little like the Supreme Court's definition of pornography, which is you know it when you see it.
No,
I'm concerned with it.
We're going to disagree, and okay. I would like any member of the panel to describe a typical ADHD in terms of symptomatology. Mark, would you like to? Since you see them in your practice.
I mean, I think the panel has been frank in, the difficulties here are immense in terms of these. I mean, it is hard. It's very hard to know how to answer this question. These kids, in my experience, when you see these kids, they are, several standard deviations different in terms of they cannot sit still, they cannot attend, they cannot, even when they are as if driven by a motive. There are some good clinical descriptions of these kids. I think part of the problem is in the community. When you are a physician and somebody comes to you as a parent and says, my child might have attention deficit disorder, it's very difficult to know what to do. And how much confirmation do you need? Do you need a teacher who also who sees many kids and says, this kid is 2 standard deviations different from the other kids in my classroom, and the parent says this kid is different, and and then even if you say this child is different, you have immense problems with trying to say, why is this child different? Is this child being abused? Is this child lead poisoned? I mean, these kids do, if you spend time around children, and I'm not going to do a lot better than the Supreme Court here, these kids stick out like sore thumbs, and they are difficult, they aggravate their parents, but then it's further confounded by the fact there are subtypes of attention deficit disorder where kids have the problems with inattention without the hyperactivity. I think, I don't think the panel is saying anything different, although we said it in more sophisticated ways, is the diagnosis is a mess. But we all have a belief that we are dealing with a very serious core problem, and that we have a diagnosis that allows us to communicate and gives us research, generates sort of ideas for research. And I think, I think part of the problem is the profession keeps changing the diagnosis. We have DSM-4, the latest thing, but we have no guarantee that DSM-5 won't give us yet another diagnosis.
You have heard arguments, beliefs, lobbying, and a small amount of science, that from Professor Carey. What do you think? Are the children normal, or do they have a real brain disease? Are you aware that if your child is on such medication through 12 years of age that he or she can no longer enlist in the armed forces? Do you understand that the drugs used to treat ADHD are addictive and dangerous, and that they can kill? Stephanie Hall of Canton, Ohio, on Ritalin for 5 years, died in her sleep for no other reason 5 days before her 12th birthday. Cameron Pettis, 14 years of age, of Austin, Texas, died an awful death from an allergic reaction to desipramine, a common antidepressant used as treatment for ADHD, a disease that doesn't exist. The $3.2 million award recently won for the family will not bring Cameron back. Telling you ADHD is a disease and that Ritalin is safe and non-addictive, they violate your informed consent rights, those born of the medical psychiatric crimes of Nazi Germany and of the Nuremberg trials. Is ADHD the epidemic of the century, or is it the healthcare fraud of the century? I testified to the consensus conference that without an iota of proof or credible science, the National Institute of Mental Health has proclaimed the behaviors of ADHD a disease, the children brain disease abnormal. Chad, 35,000 strong, funded by Ciba-Geigy, manufacturer of Ritalin, spreads the neurobiological lie. The U.S. Department of Education, absolving itself of controlling the children and rendering them literate, coerces the labeling and drugging. ADHD has no clothes. It is not a matter of misdiagnosis or overdiagnosis. It is a total 100% fraud. With no proof with which to counter Carey's assertions, mine, or the scientific record, the final statement of the panel read, We do not have an independent, valid test for ADHD, and there are no data to indicate that ADHD is due to brain malfunction. However, their confession was buried deep within business-as-usual verbiage, and they never announced it forthrightly to the press or public. They could have put an end to ADHD, the disease and epidemic, but elected not to.